This educational video is brought to you by the South Carolina Long-Term Care Emergency Preparedness Educational Program, funded by the Centers for Medicare and Medicaid Services Civil Monetary Penalty Funds.
Storms, fires, floods, an invasion of dancing zombies. You can never be sure what kind of disaster will strike, but you can be prepared. That is so disturbing. Hi, I'm Jim with the Institute for Disaster Management. Your long-term care facility must have an emergency communications plan in place for any type of disaster. And that plan should provide detailed answers to these 3 questions. Who will you contact? How will you make contact? And once you reach them, what will you tell them? During an emergency, poor communications can be the difference between life and death. So let's get it right. Joining us now is the one and only Dr. Doom. Welcome, Doctor.
Thank you, but it's really not Dr. Doom. I'm Dr. O'Neill.
Agree to disagree. Dr. Doom, can you tell us a little bit about the importance of having an emergency communication plan?
I can, but let me first tell you why I want to get away from the terminology of Dr. Doom. I focused on disasters and sort of doomsday events for almost a half a century. And I want people to think more positive rather than negative, because every single disaster gives us an opportunity to improve so that we are better able to prevent or at least mitigate the impact of the next disaster. So I prefer to get away from the negative term of Dr. Doom. I'm just Dr. O'Neill. The other thing I think is so terribly important with communications planning, every single disaster that we have faced, there have been issues related to communications. And everything that we can do to minimize those issues should be done. And I think the first step is to write a plan, an emergency communications plan. Why do we do that? We do it because we can assure health and wellness not only of patients and residents in facilities, but also staff. It's critically important. And from a practical perspective, perhaps the most important thing for everyone to realize is it's required. It's part of our regulations.
Thanks for your time, Dr. Doom.
Dr. O'Neill.
Agree to disagree.
In a real disaster, you never know what could go wrong. Okay, shut it down, shut it down.
Look, a disaster could knock out cell phone service, internet service, electrical service, and even all of those things at the same time. So that means your cell phone may not work. I know, it's terrifying. Take some time. So your emergency communication plan needs to answer the question, how will you make contact? You have to plan for all situations. Maybe the power is out, but you still have cell phone service. Maybe the phones and internet are down, but you still have electricity. Or maybe it's all down at the same time. You'll also need to have emergency supplies on hand and ready to go. We recommend backup batteries, chargers, and cables for any device that can help you keep communicating in an emergency.
We're sorry, all circuits are busy now.
During a disaster, you may get an all circuits are busy message when you try to call someone on your cell phone, but text messages, emails, messaging apps, and even some social media apps may still go through. And don't forget that many cell phones can be used as a Wi-Fi hotspot, so that if the electricity is out at your facility, your computers may still be able to access the internet through that Wi-Fi signal. The cars in your parking lot can be another source of electricity. With cell phone chargers and power inverters, you can keep phones, laptops, and Wi-Fi hotspots powered up for days. Hey kids, this is called a rotary phone. And this connected to a landline. If your facility has a working landline, that could be very useful in a disaster. I miss you, old friend. If all the phones and the internet are down, here's some options.
Rough.
You could ask a friendly CGI dog for help. Go get help, girl.
Rough.
Or go old school with bullhorns. Emergency. Sure, bullhorns are great, but here's some more options for emergency communications. Two-way radios or walkie-talkies can be lifesavers. In many areas, Fire, police, and EMS, emergency management, and public health can be reached through two-way radio systems. But you're going to need some official permission to access those frequencies. So that's going to take some preparation. Copy that. Other radio options include FRS radios, GMRS radios, and CB radios. Breaker, breaker. Got your ears on? Another choice for emergency communications is a satellite phone. They work well in remote areas and they don't depend on a cell tower. There's amateur radio, also known as ham radio. No. You need a license and special equipment to broadcast on ham radio, but you can monitor emergency frequencies. Ham radio actually has a fantastic volunteer group called ARIES that are dedicated to helping in emergencies, and you can contact them right here. You can also monitor activity using a police scanner. It's a good way to keep informed of the emergency response that's happening around you. Keep in mind that all these radios require preparation and training to use effectively. You need to make training on this equipment part of your emergency communications plan. In order to use public safety frequencies or even emergency management frequencies, you'll need to build good relationships with those agencies before a disaster. That includes getting their permission ahead of time in order to use those emergency frequencies. And that brings us to this very important point. Do not assume that help is on the way to your facility just because there's been a disaster in your area. If you're in trouble, it's your responsibility to make your situation known and ask for help. It's also your responsibility to train your staff on your emergency communications plan and the equipment they may need to use. All new staff members should be trained as soon as possible, and we recommend that all staff go through a refresher training at least once a year. I think you want to turn that. Like, no, not like, So we know who to contact in a disaster, and we looked at options for how to make contact. Now we have the big question, what will you tell them? Every disaster is different, but the most important part is to clearly communicate your most critical needs. That means anything that poses an immediate or impending threat to the health and safety of your residents and staff.
Is this the fire department? I don't know, I guess we have a problem. Can you just do something?
See, that's no good. Okay, you could go, thank you. You need to be clear and specific about your emergency situation. Describe the overall status of your facility. Do you have residents facing critical medical needs? Are the heating and air conditioning systems working? Does the facility need to be evacuated? Are there people in danger? You need to communicate clear and specific information externally and internally. Yes, you need to alert emergency services outside your facility, but clear communication within your organization is absolutely vital to protecting health and safety in a disaster. What equipment is broken? What supplies do you need? How long will they last? Everyone on your internal emergency contact list needs to be aware of exactly what's going on. That means everyone up and down the chain of command and staff members on every shift and in every department. Good communication can save lives. Poor communication can be tragic. Here's Dr. Doom with a true story.
Actually, this follows a very large hurricane event, and the hospital was out of power. They had a unit with many patients who required oxygen to survive. Unfortunately, after a period of time, oxygen was exhausted. What that unit did not know was that in a separate section of the hospital, there were actually an abundance of bottles of oxygen. But there was no communication between the two units. Patients died because of this. That's why internal communications is so absolutely critical. The right hand has to know what the left hand has and does.
I hope after hearing that story, you can really see the need for clear emergency communications. Your organization should be part of a healthcare coalition, which may have a communications flowchart with a list of essential elements of information. Of course, you'll always want to follow that carefully. Always keep in mind who you're talking to. For example, some people may be confused by EUAAs. That's excessive use of acronyms and abbreviations.
10-4, that's an AOKR. LTC uses DHS-CISA for their EEIs. Over.
See, that's totally TMA. We hope you've learned something about emergency communications. We've covered the basics, but there's so much more to it. In fact, there's a long list of rules and regulations that you'll need to know. Yeah, it's a lot. But the takeaway is to be prepared and have a detailed emergency communications plan in place and train your staff on it so you're ready to respond to any disaster. Even dancing zombies. Okay, thanks for watching. It's disturbing, right? Yet strangely mesmerizing.